The top reasons for hair loss are going to be alopecia. It can be from different sources. So there's scarring alopecia, autoimmune alopecia, or just alopecia in general. Then there's going to be elevated levels of dihydrotestosterone, which are more prevalent in males. So if you do take testosterone, it can convert into dihydrotestosterone, and it can be damaging to the hair follicles as well as the prostate. It can also be genetic factors. So if your father has, balding or hair loss at a young age, or even your mother, women have hair loss as well. They just have longer hair. It can be from stress, so neurological stress, just family stress, just work stress in general. And then nutrient status is another big one. So if you're not assimilating your nutrients well, your digestive function isn't up to par or adequate enough, you can have a lot of nutrient deficiencies and cause not enough nutrients going to the hair. And lastly, thyroid function. So your thyroid protects your metabolism, and if you're not metabolizing your nutrients and your hormones well, less nutrients go to the hair and can damage those hair follicles. Those are the top reasons why people experience hair loss. PRP helps hair growth by injecting platelet-rich plasma directly into the hair follicles. As that PRP is injected into the follicles, it contains growth factors that can stimulate the follicle to regrow. The clinical findings of PRP hair, it's about a 50-50 shot. 50% of patients improve and 50% of patients don't. There's many factors to hair loss itself, and there's many factors to actually regenerate that follicle back. PRP is beneficial for half the amount of population, but you might need blood work, you might need a medical consultation to really understand if you are a candidate for treatment. So yeah, check out PRP.